Hi, my name is Mitchell Yass. I am the owner and director of PT Squared Physical Therapy and Personal Training in Farmingdale, New York. I want to take this moment to try to discuss with you a situation that I've seen occurring over the last 15 years, and it is the medical establishment's lack of understanding how to establish the cause of pain and ultimately to treat it. Most people who have been in pain know that when they go for treatment to a medical practitioner, it typically begins by an evaluation that mostly includes some sort of diagnostic test, including an X-ray, an MRI, an EMG, or some combination of those. Ultimately, some sort of structural abnormality is found, such as a herniated disc, stenosis, arthritis, degenerative joint disease, or a meniscal tear. Once these are found on that diagnostic test, that becomes the diagnosis for the cause of pain. And all treatments subsequent to that are based on that diagnosis. The problem that you must understand is that those diagnostic tests are invalid when it comes to correlating these findings and pain. Innumerable studies have shown that as many people with no pain can be found in the same percentages to have these type of structural findings as those with pain. There have even been studies that have shown that surgeries to correct things such as vertebral fractures, which were told to people to be that those were the cause of pain, that the improvement in pain was no better for those who had the fractures corrected as those who had mock surgeries. The ability to improve the pain was no better than that for chance. And that indicated that the cause of pain was not coming from the fractured vertebrae. So it is critical to understand that not only the studies are coming back showing that the diagnostic tests are not valid, but many of the surgical interventions that are being performed have been shown to not be valid. So let's look at where we are. At this point, we have about 83 million people in the United States are considered to have chronic pain. It is estimated that that number will rise to 150 million over the next 10 years. Look at what's going on in terms of MRIs. MRIs are rampant. It is an incredibly high cost to the medical system, and it is a result of the fact that every time someone goes to see a doctor regarding pain, that an MRI and an X-ray are requested, even when the symptoms show no indication that the cause could be coming from something that could be found on that X-ray or MRI. Then let's look at probably the biggest growing industry in the United States when it comes to healthcare, and that is pain management. Everybody knows that there are pain management facilities popping up all over the country on every street corner. Well, if they are so successful at establishing cause and resolving the cause, why is there a need to manage your pain? It's absurd. And when you look at going to a pain management clinic, what exactly are you going for? To enhance your ability to understand the cause of your pain? To look further into it? Or to simply provide you with varying types of medications to mask your pain? Masking the pain will never address the true cause. What we need to do is step back and start over and get people to recognize that the cause cannot be these structural abnormalities as indicated by the failure rates of surgeries, the time frames that people are being left to seek medical attention to resolve their case, their pain, as well as the number of people who are requiring some sort of intervention for pain. So ultimately, you can see that the system as is not working. I, in my 15 years of physical therapy treating 13,000 patients, has shown that the cause is muscular in most cases. I have treated people who were told they needed surgery and resolved their pain. I have treated those who had surgery and did not resolve their pain, and yet I, after establishing the cause was muscular, resolved their pain. I have the proof, I have the statistics, I have the theory. And I can show that in most cases the cause is muscular, and for all those people who have been suffering for years and years I'm telling you now that if in fact the cause is muscular, I can resolve that pain in just a couple of weeks. I didn't get the nickname Miracle Man by accident. They've given me that name because of the fact that where people have gone through terrible periods of trying to resolve their symptoms, I have been able to resolve it in just a couple of weeks. I can give example after example, testimonial after testimonial of people that I have resolved their pain. A quick example of one which should really hit home to people is a 12-year-old boy who was told that his back pain was caused by a herniated disc and that the physician was suggesting surgery. I was able to show that that back pain was a result of the fact that the kid had strained his hamstrings, the back thigh muscles, which pulled his back out of alignment and strained his lower back muscles. With 3 months of aggressive strength training, that kid has fully resolved his symptoms, and he's back playing soccer, loving his life, and did not get that surgery. As of right now, one of the biggest misdiagnoses is the cause of sciatica. 40 million people in the United States are considered to suffer from this debilitating entity. As of right now, the cause of sciatica is considered to be a herniated disc. I will tell you 100% guaranteed this could never be the cause of sciatica. A herniated disc could never create the symptoms that are experienced with sciatica, which are pain from the butt or gluteal region down the leg. A herniated disc could never create these symptoms, and the only true cause could be inflammation of the sciatic nerve, which occurs in the gluteal region. A muscle that sits very close to the sciatic nerve, known as the piriformis, can impinge on this nerve, and in doing so, has the ability to cause the symptoms to run down the leg. Resolution of these symptoms occurs by strengthening the muscles that work in conjunction with the piriformis muscle, specifically the gluteus medius, maximus, and hamstrings. I have been saying for 15 years that the cause of sciatica is impingement of the sciatic nerve by the piriformis muscle. In 2005, a neurosurgeon in California created something called the magnetic resonance neurography. It is an enhanced version of an MRI. This diagnostic test allows the individual to see nerves as they pass through muscles versus the MRI, which only allows the person to see the spinal cord and nerve roots. The doctor has confirmed that in 90 to 95% of all cases, the cause of sciatica is the result of the piriformis muscle impinging on the sciatic nerve. I have taken innumerable people who have been told they need back surgeries and joint replacements and stopped them. I have taken people who have become addicted to pain medication and gotten them off that pain medication by resolving the cause of their symptoms. This is the chance. This is your chance. This is your one time to recognize there's an alternative to the existing system. I can provide you the answers you need in a logical method. What you have to appreciate is that if you cannot understand logically what a physician is telling you to be the cause of your symptoms, then don't accept it as the cause simply because of that degree that he has. If it doesn't make sense and it's not logical, don't believe it. I have an opportunity in New York to treat people. On my website, I have downloadable videos that will allow people to identify and understand what is causing their symptoms, and in fact, the cause is muscular. I present the exercises necessary. My goal is to go around the country doing lecturing and to reach out to as many people as possible to help them offset their symptoms. Right now, I have a woman coming from Texas, a woman coming from Georgia, and even a woman who's come from Greece who have found out about me through the internet. This is your chance. I hope that you will listen to this and take heed in my warning that if you do not look at your symptoms in an alternative to the typical things that everyone has been telling you as the cause and not getting the results, you must at least listen to this and see if it's logically based, and if so, follow through. I promise you, you will see a difference. My success rate, 90 to 95% success. When it comes to back surgeries, right now it's anticipated that at least 50 to 60% of all back and neck surgeries are found to be considered failed back surgeries. So when you look at the statistics, I would suggest you look at mine and at least give it an opportunity and see if it passes through the logical microscope. If you agree, then follow through, and I promise you, we will be able to help you resolve your pain. Thank you.